The second issue, Deputy Speaker, is I'd like to revisit the debate on hydroxychloroquine. Now, we may remember in the 28th of August last year, Australia's then Deputy Chief Medical Officer, Mr Nick Coatsworth, made some comments. And he said, and I quote, "I think Australians are very clear on which Kelly they should listen to, and that's Acting Chief Medical Officer Paul Kelly, and obviously not Craig Kelly." He continued, and I quote, "And Paul Kelly, like myself, like all clinicians around Australia, understand that regrettably hydroxychloroquine is not effective for COVID-19. Well, let's look at some of the recent evidence to test this proposition of Mr Coatsworth that it's not effective. We've also had the Chief Medical Officer on January 13th saying, and I quote, "Subsequently, there have been many studies on hydroxychloroquine for both treatment and prevention. And at this point, there is no evidence that either is useful for those." So let's look at the evidence, Deputy Speaker. Let's look at what's actually happening. Last week, Dr Peter A. McCullough, MD, MHP, FACP, FACC, FAHA, FCRSA, FCCP, FNFK, FNLA, a gentleman that has more letters after his name than the alphabet, a professor of medicine, someone that has had COVID himself, someone whose father has had COVID. He was asked a question during an interview. In your practice, did you find hydroxychloroquine to be effective? Now remember, we've got Mr Coatsworth saying, like myself, all clinicians around Australia understand regrettably it's not effective. So how did Professor McCullough answer this question when he was asked if in his practice, treating real live patients, it was effective? His answer was, and I quote, "Oh, certainly. Hydroxychloroquine is the most frequently prescribed drug for this condition worldwide. It is the most studied drug. There have been over 200 clinical studies, and the data is consistent." He continued, "It is enormously helpful." It's hydroxychloroquine. "It is enormously helpful, and as part of a multi-drug regime, there are published studies that show it is a prophylaxis, and it's about as prophylaxis as the vaccine. It can prevent about 90% of cases. It is relied upon worldwide, but unfortunately it has been politicised." Complete contradiction to what our Chief Medical Officer and Deputy Chief Medical Officer have said. It's not just Professor Peter McCullough. Here, Australia's Emeritus Professor Robert Clancy, most likely a high-credentialed immunologist in this country, said that, quote, "Craig Kelly," not the other Kelly, Craig Kelly, the Member of Parliament, "is absolutely right in saying that hydroxychloroquine is useful in early treatment studies." 5th of February, Deputy Speaker. And yet we have our medical officer saying it's ineffective. So what is the actual, what are we up to, Deputy Speaker, with some of the studies? We know, Deputy Speaker, that there are currently something like, for hydroxychloroquine, we have 29 early treatment studies. Remember, we've got our Chief Medical Officer saying at this point there is no evidence. Well, why are you not looking at these 29 studies? And 100% of those studies have found hydroxychloroquine effective. A random effects meta-analysis with the pooled results of these 29 studies has shown that there's a 66% improvement. And the probability of getting 29 out of 29 early treatment studies to all show an effective result, if it was ineffective treatment, Deputy Speaker, the probability is 1 in 537 million. So maybe, Deputy Speaker, maybe all these people are wrong, and maybe our Chief Medical Officer he's got the 1 in 537 million chance that he is right. What about some of the other evidence, Deputy Speaker, some of these studies that's referred to? Well, interestingly, Deputy Speaker, a study published, peer-reviewed, the American Journal of Medicine proposes an algorithm to treat COVID. And in that algorithm, it includes treatment with hydroxychloroquine. So what we have in this country, we have a chief medical officer that says it doesn't work. We've got in Queensland a chief medical officer that is so convinced that it doesn't work that she's criminalised it, where a doctor will go to jail for 6 months in Queensland for applying a treatment that is published in a peer-reviewed journal in the American, actually not just any peer-reviewed journal, but the American Journal of Medicine, a treatment protocol which applied in the state of Queensland would see a doctor jailed for 6 months. Deputy Speaker, I could go on with all these studies all night, but there's another two that I'd quickly like to point to. The first one, Deputy Speaker, is one out of, they say these studies don't have enough numbers of people in them. Well, again, this is a peer-reviewed study, again, published in the International Immunopharmacology. And it looked at a study in Iran, a retrospective study of 28,759 adult patients with mild COVID symptoms. And in that study, no less than 7,295 were treated with hydroxychloroquine. This study, with 11 authors, peer-reviewed, what was its conclusions, Deputy Speaker? Remember those numbers again? They treated 7,295 patients with a treatment that in Queensland would end up a doctor in jail. That study found it lowered the risk of hospitalisation by 35.3%, and it lowered the risk of death by 69.7%. A treatment that lowers the risk of death, that's found in a peer-reviewed study with over 7,000 people, lowers the risk of death by almost 70%. The same treatment will put you in jail as a doctor in Queensland. This is an outrage. This is an embarrassment to our nation, an embarrassment to our country, Deputy Speaker. And if you add up, Deputy Speaker, all the studies on hydroxychloroquine, there are 246 to date. 185 have found positive results. The probability of an equal or greater percentage of that occurring, Deputy Speaker, is, wait for it, 1 in 2 quadrillion. That is the odds that is ineffective treatment. And yet today, if a doctor in Australia is banned from using it, and if he uses it in Queensland to try and save a life, he will face 6 months in jail. Deputy Speaker, this is an outrage. This is a disgrace. It's an affront to all principles of medicine. It's an affront to our doctors, who we should trust with the sanctity of the doctor-patient relationship. Also, Deputy Speaker, when our chief medical officer was saying this drug wasn't effective, in Singapore, they were conducting, with Professor Raymond Seat from the University of Singapore, was conducting a randomised controlled trial in Singapore with hydroxychloroquine. And what did that find, Deputy Speaker? Enrolment, 18th of May, so exactly when our bureaucrats, our health bureaucrats are saying, no, doesn't work. In Singapore, they were treating over 3,000 low-risk patients as a prophylaxis. And what did they find, Deputy Speaker? They find the risk of a severe disease was 35% lower, and the risk of contracting COVID was 32% lower. Now, Deputy Speaker, on the numbers of those studies, There was only low doses. They could have even done better. But how can you have 32% and 35% improvement in a study in Singapore? I've heard other people say, oh, these studies are in these Asian countries and we should discount them. Does anyone think that the medical authorities in Singapore are not qualified to carry out these studies and these tests? And yet here we have a Deputy Speaker, 35% lower risk of severe cases and 35% risk of getting infected. In the remaining minute, Deputy